Write in the comments where you're watching from and what time it is so I can get to know you better. To support the channel for free, don't forget to subscribe and like. Every single day, your body produces one of the most information-rich diagnostic fluids in human medicine. It passes through you, gets flushed away, and most people never give it a second glance. But physicians have been reading it for over 6,000 years. Ancient Greek doctors tasted it. Medieval diagnosticians held it up to sunlight and cataloged its color, smell, and clarity. Modern laboratories run dozens of tests on it in seconds. And yet the average person treats it as nothing more than waste. What if the color of your urine this morning was already telling you something important about your kidneys, your liver, your hydration, your hormones, and in some cases, your risk of serious disease? Here is what most people do not know. Urine color is not random. It is a precise biological signal produced by a specific chain of chemical events inside your body. Each shade, from nearly colorless to deep amber to shades of orange, pink, or brown, corresponds to a different physiological state. Some are completely harmless, some are worth paying attention to, and a few are signals that should not be ignored. In this video, we are going to decode every major color your body produces, explain exactly what is causing each one at the biological level, and tell you clearly which ones require action and which ones simply mean you need a glass of water. Section 1. How your body produces urine. The filtration system. Let's begin at the foundation, because understanding what urine color means requires understanding where urine actually comes from. And the system that produces it is considerably more sophisticated than most people realize. Your kidneys are two fist-sized organs sitting just below the rib cage on either side of the spine. Every single minute, they filter approximately 1 liter of blood. That is your entire blood supply cycling through them roughly every 5 minutes. The filtering units inside each kidney are called nephrons, microscopic structures that act like incredibly precise sieves, separating what the body needs to keep from what it needs to discard. Water, salts, waste products, excess hormones, drug metabolites, and cellular breakdown products are all extracted from the blood and concentrated into what will eventually become urine. The kidneys then make continuous real-time adjustments, retaining more water when you are dehydrated, releasing more when you are well hydrated, adjusting the concentration of dozens of compounds based on signals from hormones like vasopressin, which controls how much water the kidney reclaims before urine exits the body. The yellow color that we associate with normal urine comes from a compound called urochrome, also called urobilin. This pigment is produced when the body breaks down hemoglobin, the oxygen-carrying protein in red blood cells. Old red blood cells are continuously recycled, roughly 2 million per second, and the breakdown products of their hemoglobin travel through the liver, get processed into bile, pass through the digestive system, and a portion re-enters the bloodstream and is eventually filtered by the kidneys into urine as urochrome. The more concentrated your urine, meaning the less water you have consumed, the deeper the yellow becomes, because the same amount of urochrome is dissolved in less fluid. Section 2. The color spectrum. What each shade actually means. Now that we understand what produces the baseline color, let's move through the full spectrum. Because each deviation from normal yellow tells a specific biological story. Colorless or nearly transparent urine means one thing almost without exception. You have consumed significantly more water than your body currently needs. The kidneys have retained very little urochrome in the final fluid because they are working to excrete excess water. While this sounds like a health achievement, consistently colorless urine can actually indicate overhydration, a state in which you are diluting the electrolytes, particularly sodium, that your cells depend on for electrical signaling. Research suggests that the concept of drinking 8 glasses of water per day, regardless of thirst, has no strong scientific basis. Your body's thirst mechanism is a precisely calibrated sensor, and for most healthy adults, it remains reliable. Pale straw to light yellow is the physiological ideal. It indicates that the kidneys are producing appropriately concentrated urine with a healthy balance of water and dissolved solutes. This is the range that reflects good hydration without excess. Dark yellow to amber signals dehydration in most cases. The kidneys are conserving water, concentrating the urochrome, and producing less urine volume. This is not inherently dangerous in the short term, but sustained dark yellow urine across multiple days suggests the body is operating in a chronic low-level fluid deficit that affects kidney function, cognitive performance, and cardiovascular efficiency. Orange urine is where the signal becomes more medically significant. It can result from severe dehydration, but it can also indicate that bilirubin, the liver's bile pigment, is appearing in the urine at elevated levels. This can suggest liver stress, bile duct obstruction, or early-stage jaundice. Certain medications and high doses of vitamin B2 also produce orange urine transiently. Section 3. Pink, red, brown, and blue. The signals that demand attention. Moving further along the spectrum brings us to colors that almost always carry a more significant biological message, and understanding them clearly could genuinely make a difference in someone's health outcome. Pink or red urine is the color most people react to with immediate alarm, and in many cases, that instinct is correct. The most common cause is the presence of blood in the urine, a condition called hematuria. This can range from microscopic, detectable only on laboratory testing, to visibly pink or bright red. The sources of bleeding can include urinary tract infections, kidney stones passing through the ureter and causing microtears in the lining, bladder irritation from intense exercise, or in more serious cases, masses in the kidney or bladder that warrant urgent evaluation. However, red urine is not always blood. Eating significant quantities of beets, blackberries, or rhubarb can temporarily produce a pink to red discoloration called bituria, a completely harmless phenomenon affecting roughly 10 to 14% of people due to a genetic difference in how they metabolize betalain pigments. Certain medications and some food dyes can produce similar effects. Brown or dark tea-colored urine deserves immediate medical attention in most cases. It frequently indicates one of two serious possibilities. The first is significant liver disease. When the liver is severely stressed or failing, bilirubin accumulates in the bloodstream and spills into the urine in quantities large enough to produce a brown discoloration. The second is a condition called myoglobinuria, in which muscle tissue breaks down rapidly from extreme exercise, crush injuries, or certain medications, releasing a muscle protein called myoglobin into the bloodstream that the kidneys then filter into the urine, staining it dark brown. Section 4. Cloudy, foamy, and the smells nobody talks about. Color is not the only signal your urine carries. Clarity and foam are equally important diagnostic markers, and they are the ones most commonly overlooked because most people do not think to look beyond the color. Cloudy or turbid urine, urine that appears hazy rather than clear, is most commonly caused by a urinary tract infection. Bacteria in the bladder trigger an immune response that sends white blood cells into the urine, along with cellular debris and protein from the inflamed lining of the urinary tract. The resulting cloudiness is visible to the naked eye and is frequently accompanied by burning, urgency, or pelvic discomfort. Research shows that urinary tract infections are among the most common bacterial infections in adults globally, with women at significantly higher lifetime risk due to anatomical differences in urethral length. Foamy urine that persists across multiple urinations and does not resolve after a few seconds is a different concern entirely. Transient foam from a fast urine stream is normal. The mechanical force of the stream creates temporary bubbles, but persistent foam that lingers indicates protein in the urine, a condition called proteinuria. The kidneys are supposed to retain proteins in the blood. When the filtration system is damaged, from chronic high blood pressure, early-stage kidney disease, or diabetic nephropathy, proteins begin leaking through into the urine, and their presence creates the surface tension effect that produces lasting foam. Studies consistently show that persistent foamy urine is one of the earliest detectable signs of kidney damage, often appearing years before other symptoms or abnormal blood markers. It is a signal the body produces quietly and early, at a stage when intervention is still highly effective. Section 5. What medications, foods, and supplements are doing to the color. One of the most important pieces of context for reading urine color accurately is understanding how many common substances alter it in ways that can appear alarming but are entirely harmless, and conversely, how some substances can mask genuine warning signals. Vitamin B2, also called riboflavin, produces one of the most dramatic and consistently surprising color changes. Within hours of taking a B complex vitamin or a high dose riboflavin supplement, urine can turn a vivid, almost fluorescent yellow green, a color so striking that people frequently mistake it for a serious symptom. It is completely harmless and simply reflects the water soluble nature of the vitamin being rapidly cleared by the kidneys. Asparagus is famous for producing a distinctive sulfurous smell in urine, caused by the metabolic breakdown of asparagic acid into sulfur containing volatile compounds. Interestingly, only about 40% of people can actually detect this smell, due to a specific genetic variation in olfactory receptor genes. The other 60% produce the same compounds, but simply lack the receptor to smell them. Certain antibiotics, particularly metronidazole and nitrofurantoin, can produce dark brown or rust-colored urine. Blood thinners, chemotherapy agents, and some anti-inflammatory medications alter color as well. This is why reading urine color always requires considering what you have eaten and what medications or supplements you have taken in the past 24 to 48 hours before drawing conclusions. Dehydration compounds all of these effects. Any pigment or compound is more concentrated in dehydrated urine, making food and medication effects appear more intense than they would in a well-hydrated state. Section 6. The kidney's warning system. When to act immediately. Now let's move to the part that matters most practically, the specific signals that research and clinical medicine agree should not be observed and ignored. Visible blood in the urine without an obvious explanation, no intense exercise in the past 24 hours, no recent beet or berry consumption, no known urinary tract infection, should be evaluated by a physician promptly. Painless visible blood in the urine is one of the classic early warning signs of bladder cancer, and it is one of the most important to recognize precisely because it is painless. People frequently observe it, assume it resolves, and delay evaluation for months. Studies consistently show that earlier detection of bladder cancer is directly associated with significantly better outcomes, and painless hematuria is often the first and sometimes the only early symptom. Persistent foamy urine lasting more than a week, particularly in someone with a history of high blood pressure or diabetes, warrants a kidney function test. The earlier protein loss from the kidneys is detected, the more effectively the underlying cause can be managed. Brown tea-colored urine combined with yellowing of the skin or whites of the eyes points toward acute liver involvement and requires same-day medical evaluation. Brown urine following extreme physical exertion, particularly in someone who has dramatically increased their exercise intensity, warrants evaluation for rhabdomyolysis, the muscle breakdown condition, which if severe can cause acute kidney injury. Orange urine persisting beyond 24 hours without an obvious dietary or medication cause, particularly if accompanied by pale stools and fatigue, is a combination that suggests bile duct involvement and liver stress. Section 7. Hydration. The science behind getting it right. Let's address hydration directly, because it underlies more urine color variation than any other single factor. And the popular advice around it is frequently imprecise in ways that matter. The standard recommendation of 8 glasses of water per day has no specific scientific origin. It derives from a 1945 nutritional guideline that recommended roughly 2.5 liters of water daily, but included the crucial clarification that most of this quantity is contained in food. That second half of the sentence was lost over decades of repetition. producing the widespread belief that 8 glasses of plain water is a universal daily requirement, regardless of body size, activity level, climate, or diet. Research consistently shows that urine color is one of the most reliable and accessible real-time indicators of hydration status available. Pale straw to light yellow throughout the day indicates adequate hydration for most people. First morning urine is reliably darker than the rest of the day. The kidneys concentrate urine overnight as the body conserves water during the fasting period of sleep. And this is normal. Thirst in healthy adults without kidney disease or certain medications is a reliable signal to drink. The hypothalamus, the brain region that regulates thirst, begins signaling well before dehydration becomes physiologically significant. Waiting until you feel thirsty does not mean you are already dangerously dehydrated. For older adults, the thirst mechanism becomes less sensitive with age, which is why researchers recommend that people over 60 use urine color as a more reliable guide than thirst sensation alone. Section 8. Your daily diagnostic, reading the signal correctly. Let's bring everything together, because the goal of this video was never to make you anxious every time you use the bathroom. It was to give you the biological literacy to read a signal your body has been sending you your entire life. The urine color spectrum is a real-time readout of your hydration status, your liver function, your kidney filtration efficiency, the medications and foods passing through your system, and in certain cases, the earliest detectable signs of conditions that are highly treatable when caught early and significantly more difficult to treat when they are not. The most actionable takeaway from everything we have covered is this: pay attention to persistent deviation from pale straw yellow that cannot be explained by something you ate, drank, or took in the past 24 hours. One unusual color on one occasion is almost always dietary or hydration related. A color that persists, recurs, or is accompanied by other symptoms, pain, fatigue, swelling, skin color change, is the body escalating a signal that deserves a response. The kidneys are among the most quietly hardworking organs in the human body. They filter your entire blood supply dozens of times per day without any conscious effort from you. They adjust to everything you eat, drink, and experience, and they have been leaving you a daily report in the most accessible place imaginable. Most people flush it away without reading it. You no longer have to.